So welcome back everyone. So in this episode of 5 and 5, I'm going to talk about pain relief and specifically herbs or natural medicines that will work for pain relief. So let's get into it. So number 1, white willow bark. So the active ingredient here would be salicylic acid, and this is the same active ingredient that you'll find in something like paracetamol, aspirin, or Tylenol. So salicylic acid, you can take 240 milligrams of white willow bark per day, and it has less side effects than normal aspirin or like paracetamol or Tylenol. It also inhibits that COx1, COx2 pathway, pain pathway, so the pain does not get transmitted to you, the pain pathway is cut off. But white willow bark also decreases inflammation, and it's an antioxidant, so it has some more beneficial effects as well. Then number 2, turmeric. I've talked about turmeric quite a lot. It's a potent anti-inflammatory, potent antioxidant, and it also eliminates toxins, and it's good for your liver. It supports your liver function. It also suppresses pain receptors, the same one as white willow bark, the COx1, COx2. It also inhibits, and this one you can take every single day, no side effects, and you can take it up to 3 times a day as well, and there are no side effects. Side effects come when you really like overdose, you eat it permanently, you have masses of it a day. But even those, there'll be more gastrointestinal, maybe vomiting or diarrhea. So not that serious. So you can take 400 to 600 milligrams 3 times a day if you're taking capsule. If you're eating it fresh, you can like have a thumb-sized part or like a little part that you just pop in your mouth and you chew on it, so you can add it to a smoothie or a juice. Then number 3, Pycnogenol, so pine bark. This one is fantastic to take with vitamin C because it increases its antioxidant effects, and it also increases the circulation in your body, the reusage thereof, and it also increases vitamin E function by 50 to 100 times. So the vitamin E free radical neutralizing effect, that antioxidant effect, this pine bark or Pycnogenol increases by 50 to 100%. So it increases vitamin C and vitamin E's potency in your body, so you can really try and take this every day as well. It has less side effects. It doesn't really have side effects unless you like eat loads and loads and loads of it, which is not that possible. And it also prolongs the activity of vitamin C and vitamin E in your body. So it keeps it in your body for longer so that it can work better instead of just getting it excreted. So usually when you take a multivitamin in the morning or a vitamin C, when you go to the toilet the first time, you'll see your urine is really, really yellow. So that's just excreting some of the vitamin C. So what Pycnogenol will do, or a buffered form of vitamin C, it will keep it in your body for much longer, circulating and getting used. So it won't just be excreted. So then number 4, frankincense or Boswellia resin. So this one inhibits leukotriene expression. So leukotrienes is part of your inflammatory cascade, which your body starts when there's an injury or a place that's hurt or has some problem. Leukotrienes get sent there. So this Boswellia resin or frankincense will stop the leukotriene expression, so therefore it will decrease the inflammation. And you can take 300 to 500 milligrams twice daily, and it's an analgesic, anti-arthritic, so it reduces arthritis symptoms, decreases inflammation, and the active ingredient here is the boswellic acid. So it's a fantastic thing to take if you have inflammation in your body, which most people have if they're on a typical Western diet, or if they eat high refined grains, or if they eat dairy, or if they eat animal products. Those all increase your inflammation in your body. So this frankincense will be a fantastic and a potent anti-inflammatory to take daily. Then number 5, resveratrol. So resveratrol you find in grape skins. You don't just find it in wine, as people usually say, you find it in the grape skin. So eating fresh grapes, eating the skin, fantastic. You'll get that in as well, and you'll get the beneficial effects of the fiber too. It's neuroprotective, cardioprotective, it's anti-inflammatory, it suppresses your pain pathways, so it reduces pain, it reduces what's called the tumor necrosis factor, which goes and kills some cells off as well, and your interleukins, which also are part of the that inflammatory cascade that your body secretes toward the place that has a problem or an infarction and a hurt, a prick or a cut or whatever problem it has, a lesion. And resveratrol, if you're taking a tablet, you can take 50 to 500 milligrams a day, but you can eat grapes every single day. You can make grape juice for yourself. You can drink grape juice. You can have as many grapes in a day as you want. It's just to limit the amount of pure resveratrol. Then, as a bonus, capsicum or chili pepper. It's usually an irritant. It can burn your skin and irritate your stomach lining, your mucosal lining. So it's not that beneficial to eat, but it also has a potent anti-pain effect. So when you eat it, you might have stomach irritation, but it will like take away headache or take away some other pain. And it's also put in muscle creams that help to relieve muscle aches and pains. So that capsicum can help, the chili pepper can help as an anti-inflammatory. So yeah, those are your 5 and 5 for pain relief. If you liked it, comment, subscribe, share it about. Have a healthy day. Cheerio.